Fibroids. Okay, the question is, I've been diagnosed with fibroids. I can't use menopausal hormone therapy. What do you think I should do, or what can I consider? First of all, fibroids are very, very common, and we've recently realized they may be related to vitamin D deficiency. So making sure that you're taking your excellent nutritional content in your diet and potentially some supplements. Most women actually need vitamin D supplementation. And recommendations for calcium and vitamin D are really important for bone health as well. But that's just an aside, a preventative measure. If you have fibroids and your doctor's monitoring them or you know the size of them, there are treatment options. And I will say most fibroids are quite small, not growing very rapidly, and don't need any treatment. Some get really big and they can cause what we call mass effect, or they can cause symptoms in the bowel or the bladder, or if someone, for example, is considering pregnancy. Not this person, because they're talking about menopausal hormone therapy. What can be done for fibroids? Menopausal hormone therapy is actually okay for people who have fibroids because menopausal hormone therapy is about a tenth of the dose of, for example, a birth control pill. It's a tiny, tiny dose of estrogen and if you have a uterus, progesterone, and it really doesn't impact fibroid growth. So menopausal hormone therapy may be okay. Talk to your family doctor or your OBGYN about that option. But if you definitely want to avoid all hormones because of your fibroid and fear of your fibroid growing, that's understandable. And some of the things that can be done for fibroids would include something like GnRH agonist. This is going to shut down the hormones and create a really low estrogen state in the body and really reduce estrogen stimulation to that fibroid. There's another product available in Canada called ulipristal acetate, and it can be used to, again, it's a selective progesterone receptor modulator, which means it's going to lock into the progesterone receptor and it's going to block that receptor from creating progesterone growth. So it's essentially, again, blocking the hormones. And the other thing that can be considered with fibroids is uterine artery embolization. So this is where they use an embolus or a little pellet, and it's going to block off blood supply specific to the fibroid. That actually works quite well in a what we consider to be minimally invasive way. It's done in the radiology department. And finally, a myomectomy. So this is where you have actual surgery, it can be laparoscopic or open, and the fibroid is removed from the uterus. And that would be in quite significant, severe situations where that fibroid is causing a lot of trouble because surgery has inherent risks that we generally want to avoid when we're treating fibroids. So there's a lot about fibroids, and you definitely need to see an OBGYN specialist and talk about the options that are appropriate for you in your situation. And when you need menopausal hormone therapy and you cannot or don't want to take hormones, there are other non-hormonal options we'll cover in another question.